Hi, I'm Dr. Charlie Liu, and today I'm going to be talking to you about sick day rules. If you are a person who takes medication for diabetes, high blood pressure or pain, you may need to be aware of these rules to know which medication not to take on certain days. So if you're not familiar with the term sick day rule, basically means that on days where you experience a fever or you're feeling dehydrated because of an illness, then you should not take these medications, and you should only restart them once you've been feeling well again for 24 hours at least. So there's a range of different medications that apply here, and it doesn't cover all medications by any means. So do have a quick look through the list below in the description. If you're not 100% sure about them and you do suffer from diabetes, hypertension, or you take pain medication of any kind, then contact your GP or your pharmacist, and they will be able to mark off exactly which medications you should stop taking. So the rest of the video is just going to be me listing the different medication classes. So to start off with, if you have diabetes, the three classes of medication are Metformin, the SGLT2 inhibitors, which all end in gliflozin, and the GLP-1 agonists, which all end in tide. So out of the SGLT2s, that includes Dapagliflozin, Empagliflozin, Canagliflozin, and Ertuglflozin, and most of those have brand names as well, so just check the box very carefully. Usually it has a big brand name like Jardiance and then something small like Empagliflozin underneath, and it's a smaller chemical name that you want to be careful of. Out of the GLP-1 agonists, most of these are injectable medications, but one of them is a tablet form, and that includes Semaglutide, Liraglutide, Exenatide, and Dulaglutide. If you suffer from high blood pressure and you're on a diuretic or a water tablet, an ACE inhibitor, or an ARB tablet, these are also tablets that you should stop when you're feeling unwell. So out of the water tablets or diuretics, those are Frusemide, Bendroflumethiazide, Indapamide, and spironolactone. There are others, so that's not a completely exhaustive list. And out of the ACE inhibitors, they're the ones that all end in pril. So ramipril, lisinopril, captopril, enalapril. The ARBs all end in artan, so that's losartan, candesartan, valsartan, telmisartan. Those are slightly rarer, but you may be on those. And again, if you're feeling dehydrated because of a vomiting bug, for example, you should stop those and only start them again after 24 hours. And if you take pain medication and you're on anti-inflammatory of any kind, again, you should stop those. So that includes ibuprofen, naproxen, diclofenac, and any of the ones ending in coxib, like celecoxib or atorocoxib, which are mostly used for things like joint inflammation and joint pains. Alright, so I hope that's been useful, and if you are worried and you're not quite sure which medications you should or shouldn't be taking when you're ill, then do contact your GP or pharmacist, but the majority of medications that aren't on the list that I just told you should be fine, and particularly if you have diabetes. If you're on other medications like insulin, pioglitazone, linagliptin, you should continue taking those medications even if you're feeling unwell.